Hello, my name is Dr. David Gossage, and I'm going to talk to you today about using the 532 nanometer micropulse laser for trabeculoplasty, or MLT, and how we can successfully lower the intraocular pressure as a primary treatment. The IQ 532 laser with the micropulse capabilities was appealing to me because of its potential to reduce intraocular pressure without causing thermal damage to the angle. In micropulse mode, the laser delivers energy in a series of short-duration, low-power micropulses, with each pulse followed by a pause to allow the tissue to cool. From my perspective, this follows the mandate, first do no harm, that we learned in medical school. In the study, we looked at 13 patients of 13 eyes. All the patients were duly diagnosed with chronic primary open-angle glaucoma. The intraocular pressure was 26 millimeters of mercury and had a range of 21 to 38 millimeters of mercury. Patients opted for MLT over medical therapy, and no eyes were previously treated. However, 5 patients had ALT in the fellow eye. With the MLT treatment, we used the IQ 532 laser. Prior to the treatment, bromonidine 0.15% and prednisolone acetate 1% was given, 1 drop in the eye to be treated. A rich 4-mirror lens was used. A 300 micron spot size was used with 300 milliwatts of power and a 15% duty cycle. Contiguous applications were carried out for 360 degrees of the trabecular meshwork. There was no visible treatment endpoint, and no medications were used post-treatment. The results of the MLT were as follows. We had a 4-month follow-up, and we saw an IOP reduction of approximately 18% as the mean reduction. One eye had an elevation of pressure of 1 millimeter of mercury. However, this patient underwent subsequent ALT and had no change in the pressure either, before or instead of medical therapy. And given the tissue-sparing advantages of subthreshold micropulse laser, I am comfortable offering it to patients as a first-line option. ALT can be used as primary therapy, but there are more risk with ALT over MLT. In addition, ALT typically demonstrates an 80% effect at 2 years and a 50% effect by 5 years. Although we do not know yet how long the MLT results will persist, the great advantage of MLT over ALT is that it appears to be repeatable. This is a long-term advantage in those patients who experience a loss of effect over time, but it also offers much more flexibility for treatment of patients who have an inadequate response or who have already had a previous ALT procedure. I thank you for your time, and I hope you find this interesting. If you have any questions, you can contact me, Dr. David Gossage, at igoose@yahoo.com. Thank you.